Avoiding family and big Thanksgiving gatherings may be a smart decision this year, but it's not an easy one. NBC News Social Newsgathering team heard from some mental health experts and Americans about the hardships of socially distancing this holiday.
As the total number of U.S. cases of COVID-19 increase, families like Dana Sepulowis and her daughter Dominique are observing the winter holidays virtually for the first time.
Yes, this is our first virtual Thanksgiving, and God willing, the last one, because it's very impersonal. You know, you look for those times where you can sit and laugh and joke. So it's just the camaraderie of being around each other that we'll miss this year.
Prioritizing the health and safety of loved ones during the holidays is what mental health expert Dr. Benjamin Miller with the Well-Being Trust also recommends.
You know, we need to make sure that we are protecting those folks around us. And sometimes that means it's going to be a little bit more difficult.
This comes as the Centers for Disease Control and Prevention recommend not traveling over the Thanksgiving Day holiday.
Last year, we celebrated Thanksgiving by hosting some of the international students from my alma mater, the University at Buffalo. And this year, we're not able to do it because of COVID.
It's been challenging in more ways than one. I am in the medical field. I was deemed essential from the beginning. This will be our first Thanksgiving without our grandmother. Our grandmother passed in May. Her funeral services had to be quite different. You know, we all had to wear masks. We couldn't be in the funeral home for more than an hour and a half. It's been trying. I've just been trying to adapt every day as I go by.
Adapting is also what helped Andrea Trudeau, a middle school library information specialist, recover from an accident days after this photo was taken last year on Thanksgiving Day.
And with physical therapy and diet modifications and positive attitude and grit, I made it through and was able to recover in just over about half the time my doctors thought I would. So by August, I made a full recovery. I think it taught me a lot and it helped prepare me for this pandemic. That I think when we're faced with these kinds of challenges, like a pandemic or a car accident or whatever it is, you can see it as a challenge, but I think it's important to try to find the silver linings.
Thinking in that way also helped digital artist Deja Johnson decide to observe Kwanzaa for the first time this year.
Kwanzaa is really centered around self-determination and unity and togetherness and love and creativity and reflection. It was COVID that showed me that, because the world had to stop for me to even see its place.
We can be still close to the folks around us by connecting to them through alternative means, whether that's a phone call, a video, or a letter. But I hope that once we get through this year and we all buckle down as we have been, next year we'll be back to normal, at least for seeing each other at the holidays.
I know my mom and I plan to Zoom, and she's going to teach me how to make that cornbread stuffing. And as I said to my mom, if I have to choose between a Thanksgiving meal and the health and safety and lives of my family, there's just no decision here. I'm going to obviously pick family.
Hey everyone, I'm Allison Mars. You're watching NBC News Now. At this hour, Americans are traveling in numbers we have not seen since the start of this pandemic. The TSA screening about 1 million airline passengers a day in the lead up to Thanksgiving. But most people are hitting the road this year. AAA saying about 48 million Americans will drive to their holiday destinations. Tonight, health experts are making a last-ditch effort to get them to cancel.
If we can just hang in there a bit longer and continue to do the simple mitigation things that we're talking about all the time, the masks, the distancing, the avoiding crowds, particularly indoor, if we do those things, we're going to get through it. So that's my final plea before the holiday.
COVID cases spiked after Memorial Day, July 4th, and Labor Day. So will Thanksgiving be the next holiday to accelerate this pandemic? It sure looks that way. NBC News correspondent Ron Allen is at LaGuardia Airport in Queens, New York. Ron, no doubt you are not seeing the usual Thanksgiving madness tonight, but what kind of holiday crowds are there at LaGuardia this year?
Well, the truth is, Allison, it's been really pretty slow here. I mean, you can see now it's 5 o'clock in the evening on the East Coast, and there's really no one here at this Terminal B, American Airlines. They're looking inside, and I can show you some pictures from earlier in the day. There were people here, but it's really just slowed down to a crawl. which is, of course, good news, but that's just this one terminal. Overall, as you were saying, about 1 million people a day are still traveling across the United States in defiance of the pleas by people like Dr. Anthony Fauci and others asking them to stay home. What the impact of that will be, we'll know in a few weeks' time. Every passenger that we talk to basically tells us the same thing, that they're taking precautions, they're wearing a mask, they have hand sanitizer, they've, in many cases, gotten tested before they've gotten on an airplane. The people they're going to see at the other end are trying to do some of the same things. They're talking about having dinners outdoors. They want to go to a wedding. They want to see a grandparent they haven't seen in a long time. You know, we're all tired of this and beaten down by this pandemic to some extent. So people are trying to do the best they can under a very, very difficult circumstance. Allison?
Ron, it is so bizarre to be talking to you and just looking at how quiet is behind you. It is behind you. I'm a New Yorker. I've flown in and out of LaGuardia so many times, and gosh, we all dread the Wednesday night before Thanksgiving because it's just terrible. I know you have not seen so many folks there, but for the air travels you have seen, what are they telling you? What are they doing to stay safe if they have to get on one of those planes?
You know, you'll be happy to know that there's a new LaGuardia airport that they've been working on while it's been shut down for the most part. I've not been out here in many, many months myself, and it's a really nice, gorgeous new terminal that will be buzzing probably in a few months' time, but not tonight. And yes, people are saying they're doing everything they can to be cautious and to take precautions as they travel. Here's what some people have been saying to us during the day. Listen.
Yeah, I booked this like 2 months ago. My dad actually had COVID, was really sick previously. I feel like it's needed to go home and see him, so.
I am not going anywhere. My son is actually going to Montana to meet his father. Okay. So yeah, it's really nerve-wracking though. And he's got sanitation wipes and gloves and everything, and I'm just have to pray that he's going to be okay.
And you can hear almost a feeling of guilt in many people's voices that they're doing this, but some also saying it's just something they really feel like they have to do for very deeply personal reasons. It's a tough choice. And we'll see again what the result of all this is in a few weeks' time. Allison?
Yeah, Ron, we certainly know there are folks getting on those planes who feel like they have no choice. They have family or personal issues they just have to get to. And so we certainly sympathize with people who have to make that tough kind of decision. Let me ask you, New York is one of several states with restrictions for out-of-state travelers. What are passengers supposed to do when they land here?
Essentially, they're supposed to fill out what's like a landing card with contact tracers and other public health officials. If they cannot produce a negative test from the past couple of days from where they're coming from, and they're supposed to test once they get here in a few days' time, and they're supposed to quarantine or self-isolate for the time that they're here for a couple of weeks. It's obviously a very, very difficult thing to enforce. No, we don't see checkpoints at the airports. We don't see sheriffs stopping people and trying to really enforce this in a very aggressive way. It's just very difficult to do. And across the country, there are various other measures. New Jersey, for example, today announced that they are adopting similar measures, urging people who come from any state into this area, for the most part, to self-isolate during the time that they're here and to test. Test, test, test. We keep hearing that, as we have from the beginning of all this. So before you travel, if you do, it's very important to understand what you're going to encounter at the other end, what's expected of you, what's hoped of you. And again, the restrictions vary from state to state. It's difficult to enforce, but public health officials are hoping that people just do what they're being asked to do for a short period more time until there's relief ahead down the road. Allison?
And hey, Ron, you certainly mentioned one light at the end of the tunnel. Once this pandemic is over, New Yorkers can go back to a newer LaGuardia. We have all complained so much about how annoying that construction has been, so we look forward to seeing that brand new terminal for sure. Thanks, Ron. Happy Thanksgiving.
It's a beautiful airport. And you, it's a beautiful airport. It's really nice.
Can't wait to see it.
Lots of parking.
More travelers are hitting the roads than the skies this Thanksgiving. So let's see what's going on what is typically the worst night of traffic of the entire year. NBC News reporter Valerie Castro joining me from Lake Forest, Illinois. Valerie, you're just north of Chicago at one of the nation's busiest rest stops. It doesn't look all that bad there. Are you seeing a lot of holiday traffic?
No, Allison, we really haven't seen a whole lot today, and we kept waiting for it to get worse and worse. But as you see behind me, this is I-94 between Chicago and Milwaukee. It has looked like this pretty much all day long, very smooth. And the parking lot here at the rest stop has been relatively empty. The few people that have stopped say they're just stopping for a quick bathroom break to grab a quick cup of coffee. AAA did say if you do plan to hit the roadways, you should limit the amount of time that you're stopped. AAA is expecting 47.8 million people to drive. They say 95% of holiday travelers will be driving to their destination. But so far, it looks like people are heeding the warnings, Allison.
Yeah, that is something else. You never see traffic like that the night before Thanksgiving. So, Valerie, let me ask, AAA is predicting a 10% drop or more in holiday travel this year. And along with that, they're saying that the people who do hit the roads will stay a lot closer to home. What are you hearing from the travelers you've been talking to out there? Where are they headed?
Well, Allison, that certainly seems to be the case. People are driving just a few hours to get to their destination rather than fly. I did speak to a gentleman earlier this morning who was making a 5-hour drive from St. Louis, but he said he's flown twice this year for business and did not feel comfortable flying to see family, so he is making the drive instead. And people say once they get where they're going, they're adjusting those gatherings. They're just not getting together with as many people as they would have in the past. So take a listen to what they had to say.
It's hard. It's sad. You know, it's not going to look the same. This is the one time all of our family sees each other because we come from all different areas, and it's not going to be the same this year as it normally is.
We are getting to see a family member that came from Mexico. We haven't seen them for a long time, for a year and a half, and we're planning to go and see them for Thanksgiving.
Usually we'd go see other friends and family during the holidays, but today, just because of COVID, we're just heading down to pick up a few things for dinner and then heading back home.
And I spoke to one other family who says they are traveling to their family cabin to spend Thanksgiving there, as they do every year. But they say for Christmas, they're still going to wait and see just how bad things get. They felt comfortable going around this time of the year. They say that could change by the end of next month. Allison?
Yeah, Valerie, a lot of people nervous about even thinking about Christmas plans just yet with so much uncertainty. Thank you so much for the reporting, and a very happy Thanksgiving to you.
And to you. Thank you, Allison.
The first doses of Pfizer's corona vaccine could be available as early as mid-December, but the U.S. Surgeon General is begging Americans not to let their guard down just yet.
I'm asking Americans, I'm begging you, hold on just a little bit longer. Keep Thanksgiving and the celebration small and smart this year.
Meanwhile, in Florida, Miami's Jackson Health System could be one of the first to get the Pfizer vaccine, the state closing in on 1 million coronavirus cases. NBC News correspondent Sam Brock is in Miami.
Allison, good afternoon. In Miami-Dade, hospitalizations for COVID patients have risen about 30% just in the last couple of weeks, with public and health officials both warning that with pandemic fatigue plus holiday travel, all the people that are going home to see their families, they are expecting a surge that could be worse than what we saw here over the summer when there were 2,000 plus patients in hospitals and they had to create ICU beds. Now, some good news to tell you about. U.S. Secretary of Health and Human Services Alex Azar reports they are expecting distribution of vaccines perhaps by the middle of December. They're going to be testing the distribution channels this week. And Jackson Memorial, where I am, is actually one of the first hospitals in all of Florida, the only one in Miami that's going to be receiving Pfizer vaccines as part of that first phase. But Allison, make no mistake about it, there will be a deluge of COVID patients between now and then and moving forward. Healthcare workers, doctors, nurses right now are all exhausted with this COVID war that has been going on since April. We heard from a husband and wife ICU nurse team out in Portland who said they're afraid to go home at night after their work for fear they might infect their children. Another nurse in St. Louis talked about the fact that she has been in isolation for so long, and then when she does come home, what is she coming home to? It has been exhausting for everybody. Just more reason right now to be as careful as you can. If you are going to fly, to do so exceedingly carefully. Make sure you don't pull down your mask. Eat beforehand so you don't have to do that when you're on the plane. Avoid crowded areas. and just be careful. In Miami, Sam Brock, NBC News. Back to you.
The largest hospital system in North Texas warning they could max out their ICU beds in a week. NBC News correspondent Morgan Chesky is in Fort Worth, Texas, where healthcare workers are bracing for a post-Thanksgiving rush of patients.
Allison, good afternoon from Fort Worth. We've been looking at the COVID numbers rise in Texas, breaking new records. And right now, hospital officials here are absolutely concerned. They've seen hospitalizations for COVID-19 rise by 75% over the past month. They say if the numbers continue, their ICU beds will be maxed out in 1 week. And the real concern right now is that if people don't do their part on the outside to drive down the spread of this virus, healthcare workers, doctors, nurses could be in real trouble on the inside when it comes to trying to take care of these patients, simply because while they can expand certain wings to create space, there's only X number of workers available to take care of those patients. So that's one of the real concerns right now, as Texas is now approaching a holiday season where a lot of people fear the numbers could just keep going up. Now, we also know that in Oklahoma, their 7-day rolling average is breaking records as we speak. And I had a chance to speak to doctors and nurses there. One nurse in particular, Charles Maines, contracted COVID about 6 months ago, spent 2 weeks in ICU thinking he was going to die from the virus, and he had this to say about that experience.
It's like drowning. It's like being underwater and you can't get air. You're terrified. You're scared half to death. And it came to a point where I just had to close my eyes and pray to God. I said, please help me. I need help. I can't do this. I couldn't have my family up there. My wife and my kids couldn't see me. My wife had no idea if I was going to die or live.
And it's taken Maines about 6 months to recover from the virus, but he is now back on the front lines trying to help patients that he can relate to incredibly well. His wife, also a nurse, both of them doing their best to make sure that they stay virus-free, as they have 3 daughters at home to take care of. So keep in mind that every healthcare worker, every nurse, every doctor also has a family here. And when you look at the toll that this pandemic is taking on everyone, but especially those on the front lines, there is a real sense of duty, but also fatigue as we approach this holiday season where numbers continue to keep going up. Allison.
The moment of truth is here. Thanksgiving is now just hours away. The CDC has warned that family gatherings and holiday travel could spread the virus, but it looks like millions of Americans are ignoring that. So is the rest of the country doing enough to keep this virus from getting even worse? Joining me now, Dr. Derek Cass, Yahoo News' medical contributor and associate professor of emergency medicine at Columbia University. Dr. Cass, what are your words of wisdom for our viewers who are celebrating Thanksgiving tomorrow? What do you want them to know?
That Thanksgiving is a feeling in a family, but it doesn't matter how many people are in your house. You can celebrate Thanksgiving over Zoom and eat with your nuclear family. It's really important that we do realize we're so close to the end of this pandemic with the vaccine coming, but that eating with people that are not in your nuclear family is a risk, even if you've been tested. And it's really unnecessary to find out that next week or the week after, you unfortunately were infected at the Thanksgiving dinner that was supposed to be about your, giving thanks for the situations we're in.
Yeah, look, it's only the start of the holiday season, right? We want to get through the remainder of it healthy and happy as well. I'd love to ask you about testing. The lines across the country are getting longer and longer. People are getting tired of quarantining. Cases are rising. But HHS Assistant Secretary of Health Admiral Brett Giroir said this on MSNBC earlier today.
I'm always supportive of testing, and we need to test asymptomatic individuals according to local public health. But what I'm really worried about is people assuming that if they're negative today with a test, that means you get a free pass and you can go hug grandma and be with vulnerable individuals. And that's just not the case. It is a snapshot.
The Admiral saying their testing is just a snapshot. Can you explain a little bit more what he means by that?
Absolutely. So testing as a snapshot means that when you test at that moment, that tells you if you are either positive or negative at that very moment. Unfortunately, a lot of the tests take 48 hours, 72 hours to come back. And so the time period between the test and actually when you get your results, the results then become not as relevant, especially when they're negative. What we say now to people is if you're going to screen yourself for Thanksgiving, you're really trying to find positives, not negatives. Because if you're positive, you're going to cancel your plans and stay home. If you're negative, you're going to still be smart, because what happens the day after you test and the day after that, it basically has no relevance to the results you have from that moment in time.
As an ER doctor, what are your concerns about hospital capacity as we see more and more COVID cases? We know there are hospitals around the country that are already full, if not nearly full.
Right. So we had this problem early on in New York in March and April, and we're seeing this happen over and over all over the country, where they're surging beds but can't surge staff, respiratory therapists, nurses, doctors, and the fatigue of the continued increase in patients is really getting to the staff, and they're getting sicker and sicker. So I will be honest that this wave is absolutely our worst, not just because it's the most number of patients, because it's the broadest spread of patients across the country. And I'm just really continue to be nervous about the capacity we have in our hospital systems and honestly the toll it's taking on our healthcare workers on the front lines.
Yeah, we have seen so many exhausted healthcare workers. We've aired so many of their stories already today, and your just heart breaks for how hard they are working and all they are trying to do to keep us safe and healthy. Right now, there are 2 authorized antibody treatments available, but as we understand, they're in pretty short supply. How are doctors deciding who gets that treatment, and do you expect to see more of it available in time to help people out?
So these antibody treatments are actually very specific, both for the kind of patient that's going to get them and how they're going to be delivered. And so they're not a vaccine, and they're not a magic cure for patients that are very sick. In fact, the people that get this antibody treatment are supposed to be early in their disease and at risk for getting sick. Patients who may be obese, diabetes, hypertension, high-risk profile patients. And the idea is that these antibodies will mimic their body's response before they actually mount their own antibody response. And so the reason that's important is because it gives their body an extra set of, kind of like warriors inside to really fight off this virus early on. The problem is it has to be given in an infusion center, and the person is COVID positive. So most of our infusion centers in America right now are chemotherapy centers, and that is not an appropriate place. So the delivery of these medications is going to be complicated. Finding the patients who are appropriate is going to be complicated, and it's expensive. However, when patients do get this, hopefully it will help them from getting sick or having to go to the hospital.
Dr. Cass, thank you so much for coming on with us again. Thank you for the important work that you do, and a happy Thanksgiving to you and your family.
Can I say one thing? Doctors and nurses have been working Thanksgiving forever. And we have missed Thanksgiving forever with our families. Christmases, New Year's, the whole 9 yards. This is one time we're asking you, just in honor of us, please skip Thanksgiving this year with anybody that's not in your nuclear family. We've done it before, and we can do it again.
Yeah, let me tell you, you guys are doing it for a very good reason. Hey, listen, I'm thrilled that you said it. Those of us in the news, we've all worked a holiday. It is not the ideal, but our doctors and nurses are all working this year. I'm so glad you brought that up. You're working, you're doing really, really important work. The rest of us can stay home so you can keep doing that work. We can get healthy, and hopefully next Thanksgiving, we'll all be able to be with our families, our doctors and nurses included. Thank you.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here, and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.